Genetic testing looks at a person's genes, chromosomes, proteins, and enzymes for any alterations, changes, and deviations from the normal. Genetic testing, called preconception gene testing, is a test for prospective or expecting parents who want to determine if they have a genetic predisposition for certain diseases. Thus, it is a screening for genetic diseases. Women aged 35 or older are at higher risk for having a child with chromosomal abnormalities or other birth defects, so it is recommended that they do a preconception gene test before they get pregnant. With nurses becoming increasingly involved in genetic testing, nurses are able to access genetic technology and results without difficulty. Nurses should be able to understand the implications of genetic findings so that they are able to discuss that information with their patients, while patients should be familiar with any disorders they might have, their family history, and their medical history.
Good afternoon. I'm Hannah.
I'm Kristen.
Nice to meet you. I'll be your nurse today. Tell me, what's the reason for today's visit?
Well, my husband and I were hoping to get pregnant, but
Okay.
I'm 36 years old, so we thought we would stop by the doctor's office before we started
Okay.
trying.
Do you have any biological children?
I have two.
Okay. Were there any complications with either pregnancy?
No, they were both perfectly healthy, still are, and they were both delivered naturally.
Great. Well, I'm going to take your vitals, and then the doctor will be in shortly.
Okay. Good afternoon. My name is Dr. Mrs.
Hi, I'm Kristen.
Nice to meet you, Kristen. Tell me about your reason for your visit today.
Well, my husband and I were hoping to get pregnant, but since I'm 36, we thought we would talk to the doctor first.
Alright, well, because of your age, your baby would be at high risk for some genetic disorders. However, there are plenty of women who deliver healthy babies at your age. I'll have the nurse talk to you about some precautions that I would like you to take, and I'll recommend for you some genetic testing and screenings once you are pregnant.
So do you think I should get tested before I get pregnant?
I'll have the nurse go over your family history and ethnic background. Depending on the risk factors, if you would like for you and your husband to become tested, then that's definitely an option. And we can determine if you both carry a recessive disorder gene that would increase the likelihood of having a baby with a genetic disorder.
Okay. Yeah, I'd really like to be reassured before I start trying to get pregnant that my child will be at risk.
Once Hannah goes over your history, I'll order a right with you.
Yes, please.
And you can talk to the receptionist about when would be a good time for you and your husband to come back for a test.
Okay. So tell me about your medical and family history. Are you currently on any medications or been taking any recently?
I'm not currently on any medications, but I have been taking birth control for the past 5
Okay.
years.
Do you have any known family disorders?
The only one I know of is that my mother has congenital heart failure.
Okay. Well, I will talk to the doctor about it. Okay.
Preconception gene testing involves testing a sample of blood or saliva. The sample is sent to a lab for testing. Typically, the partner who is most likely to have a defective gene is tested first. If test results show that the first partner is not a carrier, then no additional testing is needed. If test results show that the first partner is a carrier, the other partner is tested.
Listen, I have great news for you. Your family history is not going to affect your pregnancy, so you can go ahead and stop taking your birth control.
That's great. I can't wait to tell my husband.
Congratulations.
Thank you.
DNA test pregnancy results give an idea of the risk for passing along genes that can trigger certain diseases in future children. If both partners are not carriers for the disease, their baby will not inherit the condition. If one is a carrier but the partner is not, their baby will not inherit the condition. If both partners are carriers, their child will have a 25% chance of inheriting the condition. If one partner has the disease, there is an even greater chance that the child will inherit the condition. However, pregnancy genetic screening is not 100% reliable in some diseases.